I am the Consumer Empowerment Program Officer here at the New York State Health Foundation. I'd like to welcome you to our Practically Speaking series. Today's webinar will focus on practical ways clinicians can partner with patients and family members to improve the healthcare system. I'm joined today by Christine Bechtel and Jen Sweeney, who are co-founders of X4Health, which is a purpose-driven organization with a mission to make healthcare better for all people. Before we get started, I just want to go over a couple of housekeeping items. This webinar is being recorded. A recap link with recording slides, but the recording and the slides will be circulated afterwards. You'll notice that video and audio are disabled for attendees, but we'd very much like for this to be an interactive session. So please type any questions and comments that you have in the chat box throughout the event. I'll read aloud those questions from the chat box to both Jen and Christine. So let's jump right in. First, Jen and Christine, I thought that maybe you could share a little bit about your backgrounds, because I think you both have a wealth of experience that has really led you to the positions you're in today.
Happy to. I'm Christine Bechtel at X4Health, one of the co-founders, as MaKaya said. My background, I'm a consumer advocate for most of my career, spent a lot of time working on federal policy at the, obviously at the national level, some at the state level. And I did that because I realized that healthcare is very much a policy-driven system. And I then later in my career had the opportunity to embed myself in a primary care practice for about 18 months and started to provide a lot of consultation, support, and advice on how to best partner with patients and families in practice to try to create the kind of healthcare system on the ground that I had been working for federal policy. Jen, do you want to introduce yourself?
Yes, thank you. So good to be here with all of you. I'm Jen Sweeney, one of the co-founders of X4Health. And like Christine, I am a consumer advocate by background, spent many years doing community organizing. And I've also had the great pleasure of working with, I think at this point in my career, hundreds of hospitals and practices around the country to help them partner with patients and families, typically building patient family advisory councils, but also engaging them in quality improvement work groups and other strategies. So great to be here today, and I'm looking forward to the conversation.
Thank you both. So my first question is, I think the three of us can agree that patient-centered approaches have contributed significantly to advances in care and to treatments that are more respectful of a patient's preferences, values, and personal experience. But unfortunately, the reality is that healthcare professionals still hold a monopoly on the role of healer. But the COVID pandemic, I think, is really an opportunity for us to rethink new ways of working with patients to manage their care. So on a basic fundamental level, why would you say it's important to partner with patients and families right now during this time of COVID? And what does it mean to partner with patients and families?
Great. How about I kick us off and then I'll toss it to you, Christine. Great. So as I sort of step back and think about partnering with patients and families from a big picture perspective, it just occurs to me that partnering is important now more than ever in this pandemic. Most of us have been isolated and disconnected for the past 8 months in many ways because of quarantining, because of social distancing. And as I talk to people, they are telling me that they are really feeling the need for connection. They are looking for ways to make a difference, particularly in this time. And all of that to me speaks to partnership. So that's the first piece, I would say. Second piece is, in my work, I have seen time and time again that patients and family caregivers have unique perspectives, unique experiences and insights. And now is really the time to tap into them. So I know today that there are likely folks from hospitals on today's webinar. You are probably managing things like changing your family presence policies. There are likely folks on today's webinar from practices. You might be changing the ways that patients make appointments or prepare for appointments. Those are really destabilizing. They can be for patients and families, these different changes and processes and policies. It's really important to tap into patients and families to understand what are they experiencing? Are these changes working for them? And if not, how could they? What could you be doing differently to make sure that they do meet the needs of patients and families? The third thing I would say, I think probably most of us on today's webinar are aware that clinician burnout, even before the pandemic, was at an all-time high. And I think what I'm seeing as I talk to clinicians around the country is that the pandemic is only exacerbating that. And then you add things like balancing a really challenging job with kids at home doing distance learning. It's really, I think, a prescription for disaster when it comes to clinician morale and satisfaction. And the antidote to that for many folks is partnering with patients and families. There's a lot of evidence that shows that partnering with patients and families improves clinician morale and satisfaction. So I'll stop there because I could go on forever. And maybe Christine, you want to tell us a little bit about sort of how we define partnership?
Yeah, well, I'll just double click briefly on two things that Jen just said. One is that this pandemic has us all working in like totally new ways. The ways we work with care teams, the ways we work with patients and families, colleagues, other coordinating entities, public health, like you name it. And that newness has shown us that there are just a ton of things we don't know if they're really working well or not. That's true for clinicians as well as for patients and families. No one has time to just stop and like breathe and step back and say like, is the way we've had to adapt the best way? That's where patient and family partners can really help. They are like, think of them like a totally free resource to give you feedback and insight and an ability to pause and reflect a little bit on all the changes that you guys have made. I mean, the pace of change right now is just incredible and it's exhausting. And the second thing that I would say is it's happening at a time when we're all balancing like our work and family in ways that most of us really didn't have to do before. It's creating a lot of stress and strain. The research from past epidemics tells us, like Ebola, for example, we are going to see higher levels of professional burnout. That is already a problem for many, many clinicians in New York. And what Jen said about professional satisfaction being really boosted by partnering with patients and families when we get to partner in a deeper way, that's a really important strategy for just helping people feel better and more connected at this time. So what do we mean by partnering with patients and families? I'm actually going to share my screen to give you a quick visual on that right here. So when we talk about partnering, and this is, so we talk about partnering with patients, families, their representatives, and health professionals working together in an active partnership at different levels of the healthcare system. And then there are really like three levels that we're talking about here. One is partnering in direct care. This is what a lot of people think of when they think of patient and family engagement. How do we expand people's capacity to get and stay well? Two is system design and governance. And this is where we're going to spend most of our focus today. So this is the idea of people, families, consumer representatives, guiding change and ongoing operations. Again, that incredible pace of change we're all trying to keep up with. And then the third is policymaking. I've spent a lot of time in those circles. So this is really sitting on boards and bodies at the local, state, and national level, influencing decisions that are impacting healthcare. But there's also a continuum of patient partnership, if you will. So across the right-hand side of the screen, that continuum can go from a more light touch consultation. So looking in these red boxes here, getting survey information from patients, all the way up to really co-creating and co-designing by having patients, more than one, sit on safety and improvement committees, really co-leading those groups. So I want to point that out because the farther to the right up the continuum you go, the more benefit you get in terms of impact, change, and professional satisfaction.
Great, thank you. So I know that there are many ways that you can ensure the patient and family voices is represented when you're looking to make improvements in patient and family-centered care. Can you give us just some examples of creative ways to partner with patients and families right now during the pandemic?
Yeah, I will kick us off again. So the first thing I would say is if you have a patient and family advisory council already, now is the time to work with them. I've talked to some hospitals, I've talked to some practices, and The temptation is to sort of shelve that work right now because things are so tumultuous and people are so overwhelmed. And my recommendation is actually to double down on your work with your advisors. This is the time to do that. As I mentioned earlier, you all are really tackling some pretty significant changes in policies and practice. And it's going to be important to communicate those changes to patients and families within your facilities. Your patient and family advisors can help you do that. They can help you create a video, for example, an educational video for your patients and families in your institution with the right kinds of messages related to patient and family centered care. They can also work with you to do simulations. So one of the challenges that I experience a lot when I work with hospitals in particular, but also practices, is they tell me they really struggle to communicate with the patients about certain things. So providing some simulation around that with your patient and family advisors, and you can do this virtually, is a really great strategy to prepare your teams to be able to talk with patients and families in patient and family centered ways and to really meet them where they are. So that's the first thing I would say. Keep your patient and family advisory councils going and tap into them as much as possible. The second thing I would say is now is really the time to engage patients and families in your board of trustees, for example, if you're a hospital, or your quality improvement work groups. And the reason I say that, again, I recognize that everybody is overwhelmed, but what I'm seeing is that the entire population, for the most part, if you have a computer, is able to use Zoom in a way that you've never been able to use before. My mother is now doing her garden club and her book club online. Never thought I would see that happen. And we're seeing that with patient advisors around the country. So I was talking with folks at Stanford last week, and they were saying that they were having more engagement with their advisors than they ever had been before, particularly on quality improvement work groups. And it's because their advisors don't have to battle Silicon Valley traffic. It's because the advisors who struggle with chronic illness that might have sidelined them from participating in meetings that required them to get on campus, they can now do that by Zoom or by telephone, and it's perfectly acceptable in ways that hadn't been before. So I would say take advantage of your patient and family advisory council and get creative. Engage people online with your quality improvement work groups or your board of trustees. Christine, you want to talk about the virtual PFAC stuff?
Yeah, I mean, that's just a perfect setup because Jen just explained patient family advisory councils are so critically important. And also they have some limitations when they only meet in person. And so 15 months BC, before COVID, the New York State Health Foundation funded us to develop a model of PFAC that bolted on a virtual element. We called it Hack the PFAC because we wanted to make it easier, like a life hack. For practices in particular, starting with practices to operate. And so I'm going to show you this visual here of the way we created what we then called Next Gen PFAC. So it's a larger group than just an 8 to 10 person advisory council that you could then parse out. You could have subgroups working on either disease specific areas or whatever kind of topics might make sense. So it means that you don't have to limit your patient and family advisors to only things that they can all speak to, because you can have 50 or 60 of them in a next generation PFAC. We used an online community and we used a platform called Mighty Networks. We could have used something like Facebook as well. We can talk about why we made these decisions in some of the detailed Q&A. But it was a great way to both have online engagement, ideally also Zoom engagement, although at the time it was like really hard because this was pre-pandemic to get people onto Zoom, but it did, solve these problems around having to, commute to in-person meetings or having those meetings, happen during the workday, et cetera. So you could have a lot more diverse patient participants in this online model. So we can talk a lot more about it, but this is a great time to revisit this model because it really has a lot of promise now, even more than it did when we developed it.
Right. So let's say I am a leader of an organization and I want to start intentionally partnering with patients and families. What skills or capacities are important for my organization to have in place to be successful in partnering with patients and families?
Yeah, so I have a couple thoughts. The first would be that there's a culture within the organization of seeing patients and families as a resource versus an obstacle. And that sounds simplistic, but it is really foundational. I have gone into, as I said, hundreds of different institutions and systems around the country, and that really differentiates the ones who are successful from the ones who really struggle. You need to see your patients and families as a resource. I think it's also really important to have an active quality improvement infrastructure. So if you all are used to working in quality improvement work groups, you then have the capacity to bring in patients and families to help you with those work groups. I think, organizations that are really willing and interested in digging in to solve big challenges and look at those as opportunities, particularly in this environment in which we just talked about, like everybody is exhausted. Everybody is feeling, the effects of 8 months of a pandemic. So, being able to look at your team and say, listen, we can dig in and deal with these challenges, and we can have patients and families as our allies in that, I think is really critical. I think this one is a tough one. So I'll say that I'm going to caveat it before I actually let it come out of my mouth. But I think it is important. It's really good to have one single person at a minimum within your organization dedicated to patient and family centered care and to partnering with patients and families. It's too easy to sideline it or to let it, sort of fizzle out without that accountable person. And I know that's not always possible. And then the last thing I will say is it is ideal to have some financial resources at your disposal. It doesn't have to be a huge amount of money. I've seen some of the most successful patient family advisory councils only, provide parking reimbursement for their advisors. And yet, they do really, really well. So we're not necessarily talking about tons of money, but having some money to sort of bring people again in when you can, when it's safe, for lunch, or to be able to pay them for parking or for gas, to get to meetings is ideal. Those are just a couple things off the top of my head.
Yeah, the only thing I might add is just there's some kind of micro level details, like someone who has the ability to hear feedback in a positive way without feeling like defensiveness, to figure out how to navigate that in the organization, how that feedback can be considered, how to make decisions about acting on it, and then sharing the results back with, say the advisory council or the group of patients, whether it's focus group or whatever, that gave you that feedback. I also think it's great if the person who is the champion of patient-family partnerships in the institution is someone who can really energize colleagues creatively about the idea. How they can, for example, help their colleagues see, oh my gosh, I got the most amazing insight the other day that I just never thought about it from this perspective. We've got to talk to patients and families, more often. This is the kind of value case that they bring to the table, the new insights that are super interesting, and how to build excitement among colleagues. I think that's also really helpful and important.
I'll just add, in my experience, kind of piggybacking on what you said, Jen, it's really important that staff also feel like their opinions still matter. This is not just about getting patients and families in a room and having them tell us everything that we're doing wrong, where we're failing. And so in order for staff to really feel bought into it, they need to feel like their perspective is still is important, as well as patients feeling empowered to speak up and, like their input is being listened to and they can make a tangible difference. I think one way you can do that is by setting your advisors up for success and having some sort of training on preparing them for what to expect, what to look for, what to listen for, how and when to speak up so that there aren't missed opportunities of engagement with that group.
Yeah, I think that's right. Staff engagement is totally huge. In the virtual PFAC, it was a major predictor of how sort of deep and dynamic the experience was going to be, the virtual council was going to be, whether there was clinician engagement in particular. I also see a question from one of our attendees beyond PFACs, like what are other ways to bring authentic patient experience into clinical decision-making? I'll turn it to Jen in a second to go through some other tactics like surveys, et cetera. But there's one program that we're really proud of that we created called Third Conversation, that is a way of bringing both clinicians and patients together in a way that we hadn't really seen before. So I'll share my screen again. and play a quick video that gives you, I'm going to play about the first 90 seconds only, that gives you some context. And then I'm going to tell you more about how we operationalize that at X4.
I'd say 3C is the story of a bunch of people who were concerned that the existing healthcare system, especially our primary care delivery system, isn't working for patients.
Sorry,
It's
guys.
not working for practitioners. And we thought, what would happen if those people actually sat down and had a conversation together?
We realized that the human toll that the system is taking on patients is also having a disproportionate impact on clinicians. And we thought to ourselves, has anybody ever brought these two conversations together? That's why we call it the third conversation. We were hearing the conversation at the national level about clinician well-being and burnout. When we began to look deeper, what we learned was really stunning. We started to see that, half of clinicians are screening positive for depression. We learned that almost 10% have suicidal thoughts. These are the individuals who we are asking to heal, and they are having just as hard of a time.
When we were envisioning what this might look like and feel like, I think we expected people to talk about what was wrong. We expected people to talk about what they wanted from the system. I think we were really surprised, though, how therapeutic those conversations would become for both participants. It was really surprising for us.
I think third conversation is unique because it's grounded in that purpose and in that empathy, that bi-directional empathy. So I think unlike other initiatives, third conversation is a platform for building community in service of a better system.
So that's kind of the essence of third conversation. So sorry about the dog barking. Totally forgot to kick her out of my office. But the nuts and bolts of third conversation. So it's a 3-hour forum in the community where we bring patients in the community together with frontline clinicians. It's a professionally facilitated event, and they get real with each other, as you just heard, often for the first time, about what the system is like to participate in from both of their perspectives. So in terms of what we've done in the 11 or so communities that we've worked in so far, patients tell us that after they participate in the event, they feel a lot more positive about the host, clinic or system. The clinicians tell us they feel like it can help address their sense of burnout, and that this idea, they leave feeling really seen and heard and understood, often for the first time by patients, like what their reality is really like, in a way that feels very validating. And the combination of the two of them coming together with these really unique perspectives about how the system, operates, leads to some cool ideas for change. So we're really happy that the New York State Health Foundation has funded Third Conversation virtual in New York. Those were all in-person forums if you were watching online. We have just spent the last several months designing and redesigning a virtual Spark event. That's what we call those events. And they're going to be available shortly in New York State. There will be one for patients and clinicians, and then there will be another that'll be a 2-part series. First, clinicians and leaders, and then that group of clinicians and leaders who would have an opportunity to kind of process all this stuff that's going on right now would then get in a room, patients, clinicians, and leaders all together for like a longer virtual experience. So really thankful, MaKaya, to you and your team and Avital and others for the support in that work. It's really groundbreaking and rewarding.
Yes, of course. I want to get to one of the questions in the chat about, are there other opportunities to involve patients and families that go beyond advisory councils? Are there kind of things that people could do tomorrow that might be a little easier, not require as much effort to just get started on this journey?
So I'll share like 2 quick things. I know we're running out of time. One would be to send out polls to your patients. Really quick things that you want input on. So I was reading an article the other day about how one of the main reasons patients leave a practice is because of the waiting room, which to me is like crazy. So, this is a great way for you to tap into your patients and just say like, tell us about the waiting room. ask some really structured questions, but then also ask some open-ended questions, and then take that feedback and make some of those changes. Another thing that I would say is, like, this is the time to make some alliances with your patients and families that don't have to be structured like a patient and family advisory council. I've talked to hundreds of patients who love telemedicine, myself included. I've talked to hundreds of clinicians who love telemedicine. But there's a real danger that telemedicine won't be reimbursed consistently over time, and it'll go away for all of us. So this is an opportunity, I think, for some shared advocacy between clinicians and patients, if that's something that your institution is interested in. But Christine, I know you also had some real quick and dirty stuff folks can do as well.
Yeah, I just think anything you can do, especially since now everybody's on Zoom, just start before you're ready. Like our friend Bev Johnson already says, even if it's phone interviews, even if it's on Zoom, we were toying around with this idea, instead of like a happy hour, like a healthy hour, just get like 5 patients on and just ask them a couple of questions about what, really matters to you guys in your life, or even field a quick survey on SurveyMonkey. Like, it doesn't have to be a full Press Ganey patient experience survey. Just get something out there that gets some patient feedback around some of the burning questions that you guys have and the problems you're trying to solve.
Great, thank you. I want to get to another chat question. I know we're running short on time, but is there any work that can be done on building this dialogue across the various cultures and languages? So.
Yeah, and I just posted a quick answer to that. So by this dialogue, I assume you were meaning the third conversation, because that's when that question came in. So we have not done it yet in other languages. We absolutely could. We would have to find a facilitator who speaks that language, but it is definitely adaptable for that purpose. And we've done work in communities to invite people from diverse cultures, and again, cross-section of clinicians and patients in that way.
Great. A follow-up question, just one that was in the chat that I think kind of ties into that is, would you recommend that the meeting facilitator hold intentional space during these meetings for people from underserved backgrounds to be able to kind of share their experiences?
Yeah, so in third conversation, we hold a very we've hold an intentional space, period. And we invite people we encourage the host community, we're not doing it, but the host community to invite people from underserved communities. And in fact, the most powerful implementations of third conversation have been in places like Orion White Clinic in Atlanta, in a very low income part of Atlanta, or an FQHC in Allentown, Pennsylvania. Like, those have been the most just powerful, incredible events that we have seen. So there's something there that seems to be working well.
Great. Well, I know that we will provide everyone with some of your wonderful resources after this webinar. I want to again thank you, Jen and Christine, for sharing your insights with us today. And of course, everyone for joining us on this webinar. We'll also send the recording after this webinar as well. If you want to learn more about our upcoming webinars and some of the other resources the foundation has, you can follow us on Twitter, or you can sign up for our e-newsletter. Thank you.
Thanks again.
Yeah, appreciate it. Take care, everyone.
Bye, everybody.